Hey, welcome to this video. My name's Kris, and today I want to talk to you about, well, COVID-19. What else? It's been the recurrent theme in our lives the last 18 months or, even more by now. And despite the fact that it's been around for a while, I feel like we're all starting to lose sight of what's actually going on with COVID-19. From the emotional turmoil of having friends, family, patients suffering with or at risk of having COVID, to the, again, emotional turmoil of lockdowns and snap decisions and ever-changing goalposts, I feel like the way that we talk about COVID has shifted quite a bit in the last 18 months. And I really just want to kind of bring things back to focus and talk about COVID again and talk about the vaccines in a factual, non-biased way so that we can all kind of remember where we're coming from. Quick note for those who have watched my channel, my videos before, I have done videos like this in the past and I did disappear for a little while. You may notice that I've got some travel vlogs coming up. This was a last minute decision, honestly, to put things up. My partner and I went on holiday back in May and it was wonderful, and I did film it more so for us to have as like a home video, but I did kind of address the camera a few times and sort of thought maybe I'll end up putting this on YouTube. Ultimately, I had hours of footage and I broke it down into 90 minutes and I decided, you know what, that was a lot of work and effort. I may as well put it out there because I love watching travel vlogs myself. We're obviously not going to travel for quite some time now. And I figured, why not? So you may notice that the educational videos I'm posting will be scattered with travel vlogs. In the description it'll be very clear these were filmed a long time ago. But yeah, I just wanted to kind of address it because I kind of went away, travel vlog, now educational, and it's just going to be scattered from here. But that's not why you're here. So of course, let's jump into COVID-19 and what it is. So the name COVID-19 comes from COV as in corona, virus, vid, viral disease I think is where the ID comes from. So coronavirus 2019. Its proper name is the SARS-CoV-19 virus. It's not too dissimilar to the coronaviruses that we've known of the past. But the difference is it was so infectious and made people so sick on a scale that we have not seen since basically the influenza pandemic of like 1918. So nearly exactly 100 years ago. This pandemic of course did start in Wuhan, China, but spread very, very quickly across the globe. I believe, if I'm remembering correctly, the first case was noted in November of 2019. And we got our first case here in Australia in January of 2020. So it was only 2 months between basically the first infection and when we started to become affected. Of course, initially we thought maybe this won't be so bad, and it was only in March of 2020 that the World Health Organization declared that this was a pandemic. A pandemic, of course, means involving all countries. It's worldwide. So it's kind of redundant to hear people say worldwide pandemic, although I'm guilty of this too, I'm going to admit it. So that's kind of what COVID is. It's a respiratory virus. Not too dissimilar to the respiratory viruses we know. Influenza, rhinovirus, human metapneumovirus, parainfluenza. There's quite a few of them. But again, the difference is how infectious it is, how quickly it spreads, and the impact it has on us. Like other viruses of its nature, COVID-19 is spread via droplets. So basically coughing, sneezing, talking, laughing, everything to do with this area, you could be spreading COVID. Its symptoms are, again, very similar to things like rhinovirus, RSV, influenza, with headache, runny nose, sore throat, cough, fevers and chills, muscle aches, joint aches, feeling really fatigued. But the difference is the severity of the illness. In general, most people who get coronavirus will not have a significant illness. However, 15% of people with the illness will end up hospitalized and 5% will die. This is different to the other viruses that I've mentioned in this video already. The reasons people may end up in hospital vary. It may be respiratory distress, it may be neurological dysfunction, could be secondary to the fevers, dehydration, you name it. There are a lot of reasons why people end up in hospital. And people end up in the ICU and on ventilators because one of the most significant things that can happen is this really serious acute respiratory distress syndrome. Basically, your lungs don't work. And if it wasn't for the intervention of modern medicine, those people would die. And they still are, unfortunately, even with modern medicine. So it's not perfect. Like other viruses, there is no cure for COVID-19. There are really good treatments out there, I'm not denying that, but there is no cure. Just like there's never been a cure for the common cold. It's a virus, it's self-limiting, it limits itself. There are things we can do to reduce the duration and the severity of the symptoms, but it's not a bacteria where taking an antibiotic or an antibacterial agent will stop it from multiplying and causing illness. Sometimes the viruses that we deal with just need to have their own life course set out and they die. That of course doesn't really help, because what do we do if you become infected? So let's bring it back. This is a respiratory virus that is spread by droplets. So now that we know it can have a significant impact on us and those around us, and we know what it is and how it's spread, we can start talking about how we can reduce it. Because it's a respiratory virus spread by droplets, as I've already said, one of the first things that you can do is distance yourself from others physically. The ideal distance does vary depending on the literature. What I've heard more than anything else across the board is 1.5 meters. If you were to cough, sneeze, talk, the maximum distance that respiratory droplets can travel is about 1.5 meters. So if we're keeping that distance and that bubble around us, then the chances of us shedding a virus or getting a virus from someone else that's shedding it in their droplets, so their cough, sweat, blah, 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 is reduced. Of course, this is imperfect because, one, it's not like you hit a wall at 1.5 meters and a droplet couldn't go forward. Two, the coronavirus can live on surfaces. So if I touch something, then you touch that something. It doesn't matter if I'm 2 meters away from you at that point, you've touched something that's infected or has infectious particles on it. And three, it's really hard to socially distance. Even if we're adhering to everything strictly, stay-at-home orders only go out when you need to, so we are reducing the population that's in the shopping centres and other places where people would often congregate, you're gonna have to, some aisles in shopping centres aren't even 1.5 metres wide. So you are going to have to cross into that bubble. And even if we all held our breath or, just didn't cough, sneeze or talk around other people, there's still a risk because we're breathing. And it's airborne and it can be on surfaces like I've alluded to. So the second best thing we can do is mask up. So wearing a mask, you've all probably seen the same image I have. There's this great image of a cartoon character where it's kind of gross, I guess. He's urinating on someone else and the other person's urinating on them. If person A wears pants, he's probably not going to get any of his urine on someone else and he's going to get less urine from someone else on him. If they're both wearing pants, no P's crossed. Think about it like that if you so wish. So wearing masks can reduce the amount that you're shedding, the amount that you're receiving as well, reducing your risk of getting sick. This, coupled with social distancing, is one of the best ways that we can reduce the spread of this virus. This then brings us to prevention. So it's going to be out there. So I'm not a chief health advisor. I'm not anything except for a doctor who's worked on the front line since day one of this pandemic. I've worked in respiratory clinics, I've worked in vaccination clinics. I am always trying to keep up to date with what's going on. So that's where my expertise comes into it. But no, I'm not an expert that Australia turns to. That aside, it is my assumption that we are going to live with COVID for a long time. That doesn't mean that I accept that people should die of it just so we can get on with it. This virus does not discriminate. This virus kills women, men, children, all ethnicities. Doesn't matter what health issues you've had in the past. Yes, some make you more vulnerable to COVID, but that's not always the case. It's deadly. In Sydney right now, 1 in 38 people who get COVID die, and it doesn't matter who they were pre-COVID. So tying this in, because I kind of ranted for a little bit, what I'm trying to say is prevention is better than cure sometimes. We're going to have to live with it. Vaccines aren't perfect. Nothing is. Nothing I've listed is 100% going to stop you from giving or getting COVID-19. Vaccines don't stop you going into hospital with COVID, but they sure as heck reduce your risk of ending up on a ventilator, in ICU, or dying of it. And ultimately, that's the whole aim. No vaccine is 100%. You can still get influenza after having an influenza vaccine. You still can get chickenpox after your varicella vaccine. You still can get measles after your measles vaccine, but you don't hear about it as often because so many people are vaccinated that the virus itself is running out of hosts. It can't infect more people. It's super, super rare. If you are hesitant about vaccinating, gather the data, but please also remember that it's not just about you. Think about the children who can't be vaccinated because these vaccines aren't yet tested or at least approved to be used in children under the age of 12. Children die from COVID too. It's not even the deaths, as a side note, that really matter. It's long COVID as well. It's not like the flu where you get it, you get sick for a bit, you might end up in hospital, you come home and everything's dandy. We don't know how long COVID is going to last, but there are people out there with breathing difficulties, heart disease, with neurological defects, depression, anxiety, insomnia, differences in their ability to do day-to-day function, chronic fatigue because of their infection with COVID-19. And there are more and more everyday suffering. So we don't know how long this illness is going to last, even if you're out of hospital after 2 weeks. I don't know why I did this time, sorry. But yeah, so going back to vaccinations, it's not just about you. It's protecting those who can't have it. It's protecting those who can't have it because their immune system is so weakened due to cancer treatments, due to autoimmune conditions, due to other conditions that cause them to be ineligible for vaccinations. It's about protecting everyone around you. If you are eligible for a vaccine, that's a privilege. So I'm now going to read you some statistics because words are one thing, numbers are another. Sometimes they work in harmony and sometimes some people just resonate more with one or the other. As I've mentioned in other videos, I'm not so good with memorizing numbers on the camera, so I do have stats here on my phone. So apologies if you see me looking down with my phone in my hand. But as I mentioned, around 80% of people with COVID will not need hospital. 15% might, 15% do, and 5% end up in ICU or die, or both. This is for the alpha strain, mind you. The delta strain is completely different. And as I alluded to, 1 in 38 people in Sydney right now are dying because of COVID. So that's 38 people get COVID and 1 will die. When you get COVID, if you get COVID, I hope you don't, but if and when you get COVID, 20 to 30% of people will not show symptoms, but they will still spread it. So you imagine if you've got 100 people, 20% of them don't have symptoms, so they don't think they've got the virus. That 20 of those 100 people then go to school, work, shopping centres, cough by accident, breathe on something, touch their lips, not wear a mask, not socially distance. You can imagine, look at Sydney. It goes quick. These things spread quickly. That's why it's such a big issue. Vaccines are safe and vaccines are effective. Only 0.08% of those who are vaccinated will get COVID. And again, they probably won't be the ones that end up in ICU or in hospital to begin with. I'm going to have more specific stats, my AstraZeneca and my TTS, which is the clotting disorder, linked with AstraZeneca video, as well as the Pfizer video. But essentially, guys, COVID's still out there. We are going to have to live with it eventually. But let's get to a safe point where it's not going to kill as many people. People every year die of things that we try and prevent, like influenza, like measles, like meningococcal, like car accidents, like skydiving, like being struck by lightning. I don't know how you try and prevent that unless, whatever, different. What I'm trying to say is, yeah, we're going to live with it. But let's get to a point where it's not so bad. Stay safe. Stay physically distanced or socially distanced. I don't mind which way you want to say it. Wear a mask if you need to. If you're in a low-risk area like where I am, that hasn't seen COVID in 12 or so months, fine, don't wear a mask unless it's mandated. It is not taking away your civil liberties. It's not taking away your human rights. It's not taking away your, right to choose if you get vaccinated or not. It's not taking away your free speech. It's helping your fellow man. We're not controlling you. We, doctors, the government. Do you really think the government could get their act together and microchip people to follow us? No. Oh my God. If the vaccine rollout, it's anything to go by. No. But what I'm trying to say is just care for your fellow man, guys, and stay healthy and stay safe yourself. I'll be back shortly with another video about COVID-19, this time on the vaccines. If you have any questions, of course, ask down below. Like, subscribe, all that other YouTubey stuff, and I will see you very, very soon.